While we are approaching to an angry patient or relative of a patient in clinical skills communication scenarios, or also in real life clinical practice, we have to we should have combination of empathy, active listening, and effective communication skills. Number one is, I will give you a stepwise approach. Number one is stay calm and composed. You have to maintain your body language calm, even if the patient or relative is shouting at you, or if he or she is aggressive on you, you should remain calm. You have to avoid reacting like a defensively. You should not be very defensive, okay? And you should not take any anger on you personally. This is not angry patient on you. So be calm and be like with reassuring tone of voice. You have to be steady and you have to approach like this. But the next step will be you have to acknowledge that the mistake has happened. This is very important that you have to acknowledge. I'm sorry. I'm really very sorry that the mistake has happened, and I apologize from my side and from my whole team. Who is responsible? We are working as a team. We all are responsible. Again, I apologize. So 2 times, 3 times you have to say the apologize with empathetic statement. I can see that you are really upset, and I'm sorry you are feeling this way. I understand this must be very frustrating for you. So these are the words. Try to remember these words and use them in your communication. Then you have to listen to him carefully and actively. Give him chance to speak out, to show the anger to you, and you have to remain calm. Okay? So allow them to express their concern without interrupting. Don't interrupt. Let them speak. But you have to maintain the eye contact. Maintain the eye contact with your head nodding to show that you are listening. Okay? Then you have to say, again, I apologize. Again, I apologize that the mistake has happened. I'm sorry for this, that your sample has lost, or any other scenario you can say, I'm sorry for the delay in getting the test results. I understand how worrying this must be. Okay. Then, now this is the time that you have to say to him, will you please give me chance to explain you the situation correctly, clearly, and honestly. I will tell you everything clearly and honestly. So would you please give me chance to explain you? Then he will give you chance. Okay. Then you have to inform him that this mishap has happened and mistake. You already apologized for this. Then you have to inform him that the incident report has been written. Don't say I will write the incident report. Rather, you have to say the incident report has been written and the consultant already has been informed. The nursing in charge is informed and the root cause analysis team has been activated. They are trying to find out the reason why this mishap happened. They will try to find out with every step from where this sample lost. Okay. Then next time, so the root cause analysis team will assess and they will try to find out why this happened, this mishap happened. So they will give their findings and they will give the recommendations. As the result of this meeting is coming, I will inform you also what is their findings and what is their recommendation. So we will follow those recommendations. So this type of mistake should not happen again. Okay. So then you have to inform, for example, in this scenario, we have to inform the patient that we have to take another sniff test. Okay. So he will become angry or he will become clear up again, and he will say that last time my experience was not very good. It was a painful procedure, and it was done by a doctor who is, I think, he is not an expert doctor. So would you please arrange some other doctor? You will say, I appreciate your concern. This test ideally is done by giving the numbing agent. This time we will give you the more numbing agents, or will keep you more calm and friendly during the procedure. And we have the specialized team of the doctors who are doing this procedure. Last time also, the doctor who did, he has already done many times, okay, many times this procedure. So this time, if you don't allow him to do, we will arrange another doctor with the same experience and same specialty. Don't underestimate or undermine your colleague. So you have to say like this: we can arrange another doctor of the same specialty and of same experience. And this time we will keep you more calm and pain-free. Okay. Then he will agree for the procedure. Then you have to ask him to sign another consent. For any procedure, doing again, for any procedure, we have to take the consent again. Okay, so he will object. Why not? The previous consent is valid. So you have to inform him that the previous consent is for the previous procedure. Now we are going to perform the new procedure. So everything will be done with a fresh as a new case. Okay, your blood test will be done to assess your bleeding tendency. You will come like as in nothing for oral. Okay, and we will do the procedure again. So for this we need to you have to sign the consent again. So these are the points that we have to explain to the patient, and we have to take the new consent. Okay. Then you have to touch the social history. Okay, smoking history, alcohol history. In this patient, he is having already suspected case of cirrhosis of the liver. So we have to ask him how many units you are taking. So he is taking like 30 units. So you have to inform it is causing harm to your liver, and you are getting the scarring of your liver. So it is advisable to, it is recommended better to say, because I recommended to stop alcohol, and we will refer you to the alcohol liaison service. Okay, so then they will help you. They will help you to stop alcohol. Like this, you have to ask him, and then any further questions. Whom do you live with? Who is taking care of you? Are you taking care of anyone? So you need any help? How's your financial status? You need any financial support? So like this, you have to proceed. At any point of time, if he's telling that, if he's asking that I'm going to launch a complaint, so you have to say like, yes, complaint is your right, but don't say that I will help you. No, you have to inform him there is a department known as Patient Advisory and Liaison Service. You have to launch your complaint over there. Okay, don't say him I will guide you or I will help you. So these are the these words are not good. Examiner will mark it. Okay, so these are the points when we are dealing with an angry person. And at the end, you have to summarize. Not, you will not ask them what is the take-home message in angry situation and angry scenarios. So you will summarize by yourself that what we did and what we are going to do in your situation, and then end up the meeting. If he is asking or she is asking that I need a consultant, he should be here to discuss with me, inform him that the consultant has very busy schedule, so he's around, and if you want to meet with him, I will arrange a meeting with him as soon as possible. So this is all about how to approach in angry patient scenarios.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.